you're very welcome to post either comments or questions along the side. And of course, we'll give everybody opportunity as well to ask questions. Today's discussion we're going to keep pretty informal. There's some important messaging and important things that we need to consider, but I think we're going to keep the conversation pretty informal. And what we wanted to talk about is, and prepare everybody for, is that we expect, the country expects, we expect, everybody expects a significant escalation in the amount of COVID-19 infections in areas outside of the Western Cape. And in fact, in the Western Cape, they also expect significant increases. So what we wanted to discuss is that with that reality, the reality that we're going to see many more infections than we have seen to date, a really exponential amount of them in June and July and August. And at the same time, as we see many more infections, we're going to be seeing less capacity to be able to deal with those infections, whether that's in our own families, in our communities, and especially I think within the quarantining and medical facilities available. First of all, to ensure that we are all getting mentally prepared and making sure the business is as well prepared as possible, but also having a discussion around how does one ensure that from a personal responsibility perspective, one is as prepared as possible. Because I'm sure that you have found, like I have found, I think we've all found, that as lockdown has de-escalated, one tends to become a little more casual around PPE and other tools that we have in order to ensure the spread of the infection is lessened. And in fact, because we're going into a time where our likelihood of infection is much higher, and the availability of resources, for example, the availability of ICU beds is the shortfall is something like 10-fold. And if you have a look in the increase of infections, the current forecasts are saying that the Cape will be in a month's time 3 times worse than it is now. We will be where the Cape is in a month's time, and a month after that we can expect to be significantly worse off from an infection point of view. In light of this all, how do we ensure that we safeguard ourselves, our families, our communities, and our livelihood, our business, as much as possible, to ensure that we are as impacted by this as little as possible, that we are as well prepared as possible, because the situation is very dynamic, things change every day. To share, I think, in a bit of a discussion, some of the challenges I think we're all having in terms of remaining vigilant. And in fact, we need to accept that we need to be more vigilant in the next 3 months than we've been in the last 10 weeks. And that's a difficult thing to face or to contemplate, because I think a lot of us have got COVID exhaustion or fatigue. But we really need, as a group of people, to ensure that we become more vigilant, we remain vigilant, and we very importantly take that vigilance into our personal lives. And within our business environment, we pass that messaging into the business, that we have to be more vigilant than ever. An important part of that is that when it comes to our behavior at work, whether it's in an office and there's very little activity in our offices or on a site, we have very well established procedures, protocols, availability of PPE. In fact, as I think you are aware, we've received commendations from clients in terms of our COVID preparedness. We have been asked by a number of clients if we can share our procedures and protocols and audit templates with them. So I think we've done very well there. But we all need to understand that those are an absolute requirement. Those are our policy, and we have to follow that use of PPE in every business environment, business context, meeting, on-site, etc. But then, as I said, how do we ensure that we are as vigilant as possible as we go into this highly infectious time when we are going to see an escalation? And how do we prepare ourselves for the fact that we are going to see a significant increase in infections within our communities, within the Fraser Alexander business, possibly within our own families? We need to prepare ourselves for that. We need to realize how to deal with it. We need to become more and more familiar around how to deal with it quickly as time goes by. And the situation is very dynamic. We have a COVID-19 crisis committee which has met literally every single day since the 16th of March, apart from public holidays and on weekends. And we're dealing and grappling with a lot of these issues as they unfold. And we've dealt with a limited number of infections, and I think one of the reasons that we haven't been as impacted as other businesses outside is due to the extent of our preparation for this. But the situation is dynamic. We have a situation today, for example, developed yesterday, where we have an employee who is COVID-19 positive. She lives in a household together with her small children and with other people. And we're now grappling with and will resolve how do we deal with this circumstance? How do we ensure that we can support this person? How do we ensure that she can be in quarantine, that her kids can be with her? So that's how dynamic the situation is. So really today we wanted to have a discussion, do a little bit of sharing around personal experiences and how we can look at remaining as vigilant as possible, do a little discussion and sharing around additional resources we're going to make available to people in the business to try and ensure that as much as possible we can support those people in our business, especially those who find quarantining, find isolation and find following these important protocols and procedures more difficult than the rest of us. And just to give a personal example, it has become easier and it has become more difficult. You go to the shops and one has to remain vigilant about putting a mask on, pulling a mask down so that it just covers your nose. If you go into 3 or 4 shops, every shop you go into wants to spray your hand with sanitizer. One has to accept that. Make sure that you're wearing the appropriate type of mask, that it covers your face fully, that you maintain social distancing in those circumstances that you go out, that you limit going out as much as possible, that if you are outside exercising, that you wear your PPE. And these are all things that I must admit I've found increasingly difficult. I have to keep reminding myself that I must be vigilant. I have my elderly parents living with me, and they really are quite a lot older, and that helps me because I know that they're vulnerable, and that helps me just remind myself and stay as vigilant as possible. So I'd like to open the discussion up to the group. As I say, you can make comments, ask questions, put across your point of view on the messaging. But I'd also like to open it up just to get people's personal context and also to share more ideas around how we can remain as resilient as possible, and also give you some information around how the business is doing everything in its power to try and ensure to try and safeguard the people who work for the business. So I can ask some members of EXCO, we can kick off with them if they would like to jump in at this point and contribute to the conversation. Mpumi, Claire, Lawrence, Richard.
Hi, everyone. Thank you for the opportunity, Keith. As you said, it's become increasingly difficult, and we are now required to be even more vigilant than before. And just on my experiences and how I'm coping with it is I've learned to actually exercise in the morning. It assists me a lot because I get to think of something else other than COVID. And with regard to going out and shopping, we've got one dedicated person in the family. That's my husband, who goes and does the groceries. And when he comes back, we ensure that all the
processes... Has Mpumi fallen off, or have I fallen off the call?
No, she's speaking.
Okay, so I'm still here. It's not me for a change. So we've got one dedicated person who does groceries. That's my husband. And again, when he comes back, we ensure that we still apply the protocols at home. So he'll drop the groceries, he'll go into the shower, he'll bath, and then come back and spend time with the family, take the clothes that he was wearing and put it in the washing machine. So we've become extra vigilant and extra cautious. And of course, we've got family that doesn't live with us. Our parents are actually in KZN. It is very difficult. I don't want to underplay that. I mean, we haven't seen them in months. So what we do is we try and have video calls as much as possible. I know it doesn't take away from the physical contact of wanting to see your family, but I guess we mean more to each other well and alive than dead and not well. So it's a difficult time, but I think it's a time where we need to stimulate ourselves and try and find ways to remain focused and remain healthy and try not to be relaxed. Some of the stuff might seem like you are being overly cautious, but you'd rather be overly cautious. I even sanitize the plastic bags from the grocery stores, but that's just me. Thank you, Keith.
Thank you, Mpumi. Other people would like to share?
Keith Lawrence here. I think from our side, we also now, the kids, we're looking at kids going to school again. And, all of these things are nuances that one have to deal with now. And, it just comes to light again, the self-discipline at the schools. There's all these, distancing and masks and all of these things that, they follow a very strict protocol. And it's all that in between, moving to school and back, what do you do? Keeping your own family disciplined around all of these things and making sure that we follow the procedure. And I think, even in the Fraser context as well, we've done a lot around what we do in the work environment. And I think if we take those same learnings, into our home environment, we've seen it being very successful. We've seen exposures where people have followed protocol and have not picked up this virus. So it does work. So for us at home, we're trying to follow strict discipline around this and strict protocol. And, so far so good. Not always easy, but, everybody standing together helps.
Definitely, yeah. I think, Lawrence, you've touched on something there that's quite important, is that we all have our little bit to do, because what we need to remember is that we're part of one ecosystem at the end of the day, and what I do has an impact on whether or not my neighbors get COVID, and whether or not the children who now go to school with my children are impacted. And my husband and I were having this conversation last night. We were saying that it's almost harder now when we're in level 3, as our kids go back to school, and as that propensity to take risks, there's a bit of a shift. Whereas when we were in a hard lockdown, it was easy to make decisions. It was easy to know exactly what was expected of us. We went to the shops once a week. We bought groceries. We bought them back. We sanitized them. Like the bags. And we've got a place in our scullery where those bags have to stay for 3 days before they're allowed back into the general area. And there were all of these rules that were very easy to apply. But as things change, as we sort of open up to letting other people into our sort of area and into our lives, that we're interacting more, and then we need to change those rules and adjust slightly. And that's where it gets really difficult. And at the same time, you want to we're putting hygiene measures and social distancing measures in place, but at the same time, we've got to look after the psychological well-being of our families too. So my compromise has been that, and this is not, necessarily based in science, it's just where I've got to as an individual, is that there's less risk outside, and if people are wearing masks and social distancing. So we do exercise a lot. We do get out. We get on our bikes. We run, and I've allowed my kids to get out into our local park, and which is a very large area, and ride their bikes and just be outside a little bit and feel connected to a greater group and a greater community of people. And I think that although it is not completely foolproof in terms of exposure to COVID, it has allowed us to feel the need for a little bit of interaction and feeling like we're part of a greater community, but at the same time sort of mitigate the risk as best as possible. And I think that that's worked quite well for us. I think one of the important things that we need to remember too is that as an organization, we were early adopters. We didn't wait for someone to tell us to close our office and all start working from home. We saw the risk factors rising, and we reacted to it. And so as we move through level 3 and possibly 2 and hopefully 1 eventually, we need to make sure that we're always applying common sense to what we do. And just because the government doesn't tell us when to exercise, that we still then go and find some time to exercise. So I think we have to keep thinking and coming at the risk that's in our area. And for my part, I think what that means is that we're all putting quite a lot of effort into understanding the testing protocol of our business, making sure that if we need quarantine facilities, they will exist, that our networks are as strong as they possibly can be. At the moment, we're getting very close to senior members of Discovery, so that if we need to be able to support the people who work at Fraser's, we are able to do that. And then also that we continue to support our CSI initiatives, because we know that there are people out there who are really struggling, and that once again we are part of the same community, a larger community, a South African community, and we need to make sure that we are supporting each other in any which way that we can. So I also find that that's quite helpful from the psychological wellness point of view. Thanks.
Thanks, Claire. And I think it's also a good opportunity to share what we have been doing. And as I say, there's a large crisis committee, about 20 people in the business. And there's an awful lot that the business has been doing in order to prepare as best we can, from considering testing and screening regimes, putting protocols and procedures for transport and site activities in place, doing a lot of networking within the mining industry, within the insurance community, and within the medical provider community, to make sure that we are able to support people, not just here, but also in far-flung areas, because, of course, Fraser Alexander is different to a mine that has a couple of concentrated areas they have to be concerned about. We have our team spread out over a lot of areas, and that support is also extended, as I'm sure you're all aware, into the communities where Fraser has, at this stage, committed over R500,000, or about R500,000 exactly, in fact, to direct community feeding programs. And on that, an important part of this discussion is how do we protect the most vulnerable? And the most vulnerable people in our business are those people who don't have this ability to social distance as easily as most of the people on this call do. We are busy considering, we have allowed people to take PPE home, and now we are busy considering under what circumstances. We're busy having a look from our procurement point of view and from a logistics point of view, to what extent can we get face masks, rewashable cloth face masks, and sanitizer and soap out to our most vulnerable employees' households, so that we can assist them as much as possible in terms of following the social distancing. And I've stressed to the crisis committee group, and we're all aware of this, that actually following the basic principles of social distancing of 1.5 to 2 meters, or 2 meters, washing your hands, wearing a face mask, and not touching your face, is actually extremely effective in terms of avoiding the spreading of COVID-19. There's a couple of messages here. I think some people are struggling to hear a little bit, and I hope they can all hear now. I just want to read out a couple of these messages, because I know quite a lot of people have dialed in. This one's from Vili Leroux, who just says, everyone needs help from time to time, and during these uncertain times it can be more often. There is no shame in it, in reaching out to a trusted friend if you need help, an ear to listen to, or just a shoulder to cry on. Seeking assistance requires strength. This will help build up your resilience over time. And I think it's very, very important that we aren't scared to ask for assistance when we need to. We really are. And my job isn't to scare people. My job isn't to create panic. But we really are facing a much more difficult time than we've come out of. And I think that's very good advice from you, Vili, and Mariska has replied to Vili, just saying she agrees with him, and we should not hesitate to make use of the EAP services. They've been amazing and a great help to a lot of people in the business. So please, everybody, don't forget about those services. And as I say, we're really trying to understand how we can continue to help those most vulnerable people. I think as the situation is so dynamic, this new situation of a lady who's got kids, and we need to ensure that we can quarantine her while still making sure her children are protected, is a unique situation of today, but it won't be soon. We're going to see many, many more of these different type of situations cropping up. And what we can do is every time they crop up, we then ensure that we deal with them responsibly. And that will just build our knowledge and our bandwidth and our resources to continue to deal with more and more cases and more cases in that come along that have different circumstances attached to them. Enoch's commented, we are living in very challenging times of our lives. You will be mentally challenged as you'll have to deal with this pandemic both at work and at home. At some point, it's not if not experienced already. The only way to comfort yourself is to ensure compliance at all times. We need each other more than we ever did. Let us hold each other and be strong. And I think these are very important messages coming through. It really is going to take everything that we have to ensure that we're resilient during the next several weeks as this pandemic continues to roll out. Folks, we very importantly need to take this messaging forward on the sites. Please, we'd like this messaging around reinforcement of sticking to the basic regimes that we put in place in terms of social distancing, wearing face masks, washing hands, not touching your face. Make sure that they are covered in toolbox talks and all the sites, making sure we communicate to all the people in the business. We'll be sending out emails and SMSs to ensure we reach everybody in the business, just reinforcing these messaging. And as I say, we're also going to be looking at ways of trying our best that we can to support people who are in the most difficult environment from an isolation and managing of COVID-19 perspective. Folks, I can't see any new messages coming through, but the floor is open to anybody who would like to comment or share. So thank you. I think if anybody, as I say, that's a broad crisis communications group, and I'm sure they are communicating into the business continually. We meet every day. We deal with a lot of issues. I'm sure they are communicating to business, but please keep communicating. Keep asking questions if there's areas you want to clarify. But it's very important. It's incumbent on all of us to keep communicating into the business. Keep people prepared. Keep people vigilant. Ensure that we all follow these basic rules as diligently as possible, and in circumstances where we can assist, we assist as much as we can to safeguard the livelihood of our people and our business. So folks, thank you very much. If there's no other questions or comments, or from Exco's side, if there's anything I've missed out.
You've covered everything on my side, Keith.
Good, thank you, folks. Thanks for dialing in. Please pass the messaging on. As I say, we'll be sending out emails and SMSs just to reinforce it. And please be vigilant. Please look after yourselves, look after your families, and together let's look after our livelihoods. Thank you very much.